All right, welcome. Today we're going to get into something that it's the absolute bedrock of our craft, right? Structuring a therapy session. Let's think of this as a real deep dive, a masterclass, if you will, on how to create a space for our clients that is focused, effective, and truly collaborative. Honestly, this one skill, it can make all the difference. So let's jump in.
I mean, come on, who hasn't felt this? You're looking at the clock, you hear that tick, 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 and the session is just completely off the rails. It's gotten away from you. You feel overwhelmed, your client's unfocused. It's this sinking feeling, you know? And look, it's a super common anxiety, especially when you're starting out. But trust me, it's something we can absolutely get a handle on with the right approach.
So let's be really clear about something right off the bat. When I say structure, I am not talking about some kind of rigid, robotic script. That's not therapy. The real art here, it's about creating a reliable container. Think of it like that. A safe, predictable framework that actually gives the client the freedom to do deep, efficient therapeutic work. This is what turns a simple conversation into something that's genuinely healing.
Okay, so let's say your diagnosis is solid. Your treatment plan is on point. But the sessions, they still feel chaotic, all over the place. So what gives? Well, the problem usually falls into one of a few really common traps. And I want to be clear, these are things that even the most experienced therapists can fall into. So let's shine a light on them so we can see them coming.
And here they are. First, there's that hesitation, failing to gently interrupt when you need to. Second, maybe not fully socializing the patient into how CBT works, that collaborative model. Third, you might have a lack of patient engagement or really fuzzy goals. And finally, and this is a big one, a weak therapeutic alliance. Think of this as your go-to checklist. When a session feels off, just run through these in your head. 9 times out of 10, your answer is going to be in one of these 4 buckets.
But before we even start pointing fingers at session dynamics or the clients, we got to turn the mirror on ourselves. Because so often, the biggest barrier to structure isn't out there, it's in here. It's our own internal chatter, those pesky automatic thoughts. And it's so important to just acknowledge that. This self-doubt is totally normal, and the good news is we can absolutely learn to work with it.
I mean, does this one sound familiar? He's going to get mad if I'm too directive. Oh, this is such a classic. It's that thought that just freezes you in your tracks, right? We get so worried about how the patient might react that we pull back from giving them the very structure and focus that they actually came to us for.
Or how about this one? I really shouldn't interrupt her. And look, this one usually comes from a really good place, right? It's about respect. We don't want to be rude. But we have to remember, in our line of work, letting a session just ramble on isn't a kindness. When we don't interrupt, we risk an hour that's just unproductive. And that, ultimately, doesn't help the client at all.
So what do? Well, it's pretty simple, really. We use our own tools on ourselves. It's CBT for the therapist. Step 1, just notice those thoughts. Catch them as they pop up. Step 2, evaluate them. Challenge them. Is it really true that the client will get angry if you provide structure? And step 3, problem solve. Okay, so what am I going to do differently in the next session? It's our own model, turned right back on our own practice.
Okay, so we've done our internal work. Now let's get down to brass tacks. Let's walk through an actual session piece by piece, starting with those first 15 minutes. And these are so critical because this is where you set the tone for the entire hour. It all starts with the mood check, and that's our foundation.
The mood check. Now, it is so easy to see this as just, more paperwork. But it's not. It's our first data point. It's a quick, objective snapshot of where the client is at. It helps us track progress week to week, and it lets us spot any big shifts right away, all without us having to spend 10 minutes playing 20 questions.
But of course, it's never that easy, is it? So what happens when the patient is just annoyed by the forms? Or maybe they genuinely struggle to even put a word to how they're feeling. This happens all the time. It's a real clinical challenge. So let's break down how we can navigate that.
Okay, check this out, because this is all about clinical nuance. If the patient's just a little bit grumpy about it, like, these forms are a waste of time, you can give them a simple, logical rationale. You say, hey, these actually save us time. But if the pushback is stronger, if they're saying, I hate these things, they're worthless, that's a different story. Then you have to prioritize the alliance. You bend. You say, okay, let's skip them for now. How about we just do a simple 0 to 10 scale? See the difference? The relationship always comes before the paperwork. All right, mood check is done. Next up,
the brief update. The goal here is super simple. Get a quick highlight reel of their week so we know what to put on the agenda. And I cannot stress this enough. The key word here is brief.
And this is where we can get into trouble. This is the quicksand. You ask for a brief update, and suddenly you're getting a minute-by-minute replay of their entire week. And before you know it, 15, 20 minutes have gone by, and you haven't even set an agenda yet. That time is just gone.
So what do? You need to have the words ready to go. Something just like this. Hey, can I just jump in for a second? Right now, I just need to get the big picture. Could you maybe give me the 2 or 3 sentence version of your week? It's brilliant, isn't it? It's so gentle, it's respectful, but it's also perfectly clear. You're not shutting them down, you're just gently guiding the ship back on course, all for their benefit.
Okay, we've successfully navigated the opening 15 minutes. Now we're moving into the main event, the heart of the session. This is all about setting that collaborative agenda, and then finally, diving into the real work. This is where the therapy really happens, but again, only if we stay focused.
But what about this scenario? You ask that crucial question. So, what should we put on the agenda today? And you just get crickets, a shrug, an I don't know, maybe even a little bit of resistance. It's a huge challenge, and it can happen for a bunch of reasons. Maybe they're just confused, or maybe their last therapist did things totally differently.
And here we have 2 beautiful, distinct strategies. So if the patient is genuinely just stuck, they say, I don't know, you give them a gentle prompt. Tell me about a time this week when you felt the worst. That can unlock things. But if they're resistant, saying something like, my last therapist just let me talk, you don't argue. You compromise. You meet them halfway. Okay, how about this? You come in, you talk for the first 10 minutes, and then we pick one thing to focus on. It's about being flexible.
Now, this might be the toughest one of all. You hit the wall of hopelessness. The patient is just so overwhelmed that even talking about a problem feels, well, pointless. And man, that feeling can bring a session to a grinding halt before you even get started. This response, this is just a masterclass. You start with pure validation. You're right. It's true. We can't fix everything at once. You join them in that feeling. But then you pivot. You gently shift them toward action with a forced choice. If we just have time to work on one thing today, which one will help the most? You've just lowered the stakes from solve my entire life to let's just pick one small thing. It's incredibly powerful. All right, we're in the home stretch. How you end the session is every bit as important as how you start it. You can't just let it fizzle out. A strong ending is how you stick the landing. It's what solidifies the learning, it empowers the client for the week, and it strengthens that alliance we've been working so hard on.
Now, when we talk about homework, and honestly I prefer to call it an action plan, this checklist right here is pure gold. You can't just toss an assignment at someone and hope for the best. You've got to provide a good rationale. Make sure it's not too hard. You have to explicitly teach them how to do it. Better yet, start it right there in the session. Have them write it down and then troubleshoot. What might get in the way of this? Doing this stuff makes it so much more likely that the therapy continues after they walk out the door.
And this is a non-negotiable for me. You have to protect the end of your session. Always leave 5 to 10 minutes for the wrap-up. This is an optional time. This is for summarizing, reviewing that action plan, and, this is huge, asking for feedback. It prevents that horrible, rushed feeling at the end of the hour and makes sure your client walks out feeling heard, clear, and like a true partner in the process.
And in the end, it all comes down to this one question. This should be printed out and taped to your desk. How can I help this person have a better week? That's our North Star. Everything we've talked about, the mood check, the agenda, the gentle interruptions, the feedback, it's all in service of this one simple goal. Structure isn't about being rigid. It's the framework we build together with our client to answer this question, session after session after session.